So apparently the late Hugh Hefner preferred to be deaf rather than give up sex. Hi guys, Cliff Olson, Doctor of Audiology and founder of Applied Hearing Solutions in Phoenix, Arizona. And in this video, I'm talking about how treating erectile dysfunction could give you a hearing loss. Coming up. Crystal Harris, the widow of the late Hugh Hefner, founder of Playboy, recently revealed in her memoir that Hugh Hefner lost his hearing in one of his ears due to excessive use of Viagra. As it turns out, Hugh Hefner is not the only guy to lose his hearing due to the use of drugs intended to treat erectile dysfunction. In 2022, approximately 10 million men were diagnosed with erectile dysfunction in the United States alone. The likelihood of developing erectile dysfunction significantly increases as men age. Depending on what statistics you look at, men over the age of 40 are 3 times more likely to develop erectile dysfunction than men that are below the age of 40. Naturally, based on these statistics and having recently turned 40 myself, this particular topic interests me more now than what it did when I was younger. And since we're all adults here, we should be able to talk about this topic and keep things professional at the same time. So if you don't think that you can do that, it's now time to bounce off of this video. That being said, erectile dysfunction, abbreviated ED, is the inability to get and maintain an erection that is firm enough for sexual intercourse. It occurs due to the lack of blood flow to the penis, which can occur naturally, but it is exacerbated by several other things, including taking medications to lower blood pressure, vascular disease, diabetes, renal failure, COPD, smoking cigarettes, and obesity, to name a few. Alright, so at this point you're probably thinking, Cliff, you are not a urologist, why are you talking about erectile dysfunction? That is not exactly what I tune into your channel for. But trust me, erectile dysfunction does have a lot to do with your hearing. Now, when it comes to the treatment of ED, physicians will often prescribe a PDE5 inhibitor, which will block the naturally occurring PDE5 enzyme. The inhibition of this enzyme will relax blood vessels, increasing blood flow to the penis, allowing a man to get and maintain an erection. The discovery that PDE5 allowed men to get erections was accidental because pharmaceutical companies were looking to use these drugs to treat hypertension and angina. But after this discovery, these drugs started to hit the market in 1998. Now, 25 years later, the treatment of ED using PDE5 inhibitors like Cialis, Viagra, and Levitra are now a $1 billion a year market. So what do these drugs actually have to do with hearing loss? Well, over 2 decades ago, the FDA started getting reports of sudden hearing loss from users of these specific types of ED drugs. In a 2009 retrospective review of individuals who suffered a sudden hearing loss within 24 hours of taking a PDE5 inhibitor, researchers concluded that while the data was inconclusive, there was a potential link between PDE5 inhibitor use and sudden sensorineural hearing loss. Fast forward to a study published in 2018, researchers evaluated 1,233 cases of sudden sensorineural hearing loss and identified that there was a small but significantly increased risk of sudden sensorineural hearing loss associated with the use of PDE5 inhibitors. Shortly after the link between PDE5 inhibitor use and sudden hearing loss were identified, the FDA changed the warning, and they actually rewrote the warning labels of Cialis, Viagra, and Levitra, which now read, physicians should advise patients to stop taking PDE5 inhibitors, including Viagra, and seek prompt medical attention in the event of sudden decrease or loss of hearing. These events, which may be accompanied by tinnitus and dizziness, have been reported in temporal association to the intake of PDE5 inhibitors, including Viagra. It is not possible to determine whether these events are related directly to the use of PDE5 inhibitors or to other factors. This was taken directly off the labeling for Viagra, but it is the same labeling for Cialis and Levitra. The hearing loss now associated with these drugs is actually called Viagra Deafness. So how is it possible that these particular drugs are actually leading to cases of sudden sensorineural hearing loss? Well, we already know that cardiovascular issues lead to higher rates of hearing loss, so it is no surprise that PDE5 inhibitors which have some effect on the cardiovascular system, could also create an increased risk of hearing loss. It could also be that these particular types of drugs are ototoxic, meaning they cause damage to the structures inside of the cochlea, leading to additional hearing loss. Even though the hearing loss linked to PDE5 use is unilateral in nature, and about 33% of those hearing losses automatically recover on their own, it is still scary to know that you are at a higher risk of developing a sudden hearing loss in one of your ears that could end up being permanent just by treating your erectile dysfunction. With all that said, what can you do about it, and can you actually reduce your risk of developing a sudden hearing loss using one of these drugs? First and foremost, control what you can control. This means eating healthy and exercising. This will reduce your risk of obesity, diabetes, and cardiovascular issues, and for the love of God, stop smoking. If you can get rid of all of these risk factors, your risk of developing erectile dysfunction in the first place is significantly lower. Now, if you're already doing all of these things and you still happen to develop erectile dysfunction, make sure that you follow your doctor's instructions for how much of these drugs you should be taking. If you do that and you still happen to notice that you have a sudden drop in your hearing in one of your ears, you need to immediately get your hearing tested. I'm not talking in a few days or in a few weeks. I'm talking immediately. You need to schedule an appointment with an audiologist to have your hearing tested, and it would be a very good idea to tell them that you took a drug for erectile dysfunction so they're aware of it. Once they diagnose your hearing loss, they will get you pointed towards the proper medical professional to address the issue. And I cannot stress this enough. Time is of the essence when you have a sudden sensorineural hearing loss, because the ability to recover your hearing depends on how quickly you can get treated. Now, if the damage is done, meaning you've gone over 2 months and your hearing has not recovered significantly, most likely that hearing loss is permanent, and you need to go back to the audiologist to see what your treatment options are. This could include treatment with a hearing aid, a cross device, a bone-anchored hearing aid, or even a cochlear implant. Now, if you're interested in learning more about any one or more of these different treatment options that you have to treat sudden sensorineural hearing loss, I will have some videos linked down in the description for you to watch. At the end of the day, if you suffer from erectile dysfunction and you need to use one of these PDE5 inhibitors to treat it, just make sure that you understand the risks of doing so and use these drugs responsibly so you don't end up losing your hearing like Hugh Hefner.